वो शायद कनेक्टेड है।
Yes, hello everyone. Am I visible to all? Just if you can confirm that I am visible to all. Great, great. So nice to have all of you. So once again, welcome to all of you who are attending this inner circle of 2025, the first one here. And those of you who are here for the first time, just type me in your comment box and also put in your name and location so that we can just acknowledge all of you in the inner circle group. So those of you for the first time, just let us know about you. Yes, Dr. Harish Kumar from Tamil Nadu, Dr. Varsha, great. Dr. Varsha is from Bhopal, great. So nice to see some new people, and I think I can also see a lot of our doctors who routinely attend. Dr. Ahmed from Punjab, great. And I can see a lot of other doctors, Dr. Amol Mahabal, Dr. Arushi, Dr. Sham Sundar, Dr. Kiran, Dr. Kunjan, Dr. Kaustov, Dr. Varsha, Dr. Ira, Dr. Prachi, Dr. Mahmood, great, great. Dr. Dipti Bhatt, Dr. Chandu, Dr. Arsala, so nice to see all of you here. Great. Dr. Varsha, you are attending the right program. And soon I want to introduce to you all Dr. Mayuri. But before that, I want you to know some community updates. So regarding the community updates, first we are launching the first of its kind chairside assistance program, which means that a few handpicked mentors, experts from our community have been enrolled by Impact Airline series, and they will be helping you out during your surgeries, which means that any one of you who needs any kind of chairside support during your surgeries, you can just connect with Trisa Enterprise, and an entire scheme of arrangement has been made where the experts from your city, nearby city, will be made available to you so that they can handhold you during the surgeries. So how many of you find this mind blowing? Just let me know. Where first time ever for your basal implant, you will get a complete hand holding in your clinic. Just type mind blowing if you find this amazing. And if you need any help for your basal implant cases, you can connect with Risa Enterprise on 9321533493. So this is one major community update, one major announcement. So this is one important community announcement where you will be getting chairside support. So let's see if this is getting too dark. Let me just move in some light. So yeah, just put it out, please. Okay. The second community update. The second community update is that the 3-day course will be held in Mumbai, that is from 24 to 26 of Jan. So we have a few limited seats available. So those of you who want to join our Mumbai course, it's coming up on 24th to 26th of Jan. Next, the zygomatic course, it will be in Mumbai again on 9th of February. So there are two events which are lined up in Mumbai. One is from 24th to 26th of Jan, venue is Mumbai, and another is the zygomatic course, which will be on the 9th of Feb. Next, we have the 3-day course in Coimbatore by Dr. Subodh sir, which will be in February, which is from 14th to 16th of February. So there are two events, 3-day events happening, one in Mumbai and one in Coimbatore. So wherever you find it comfortable, you can enroll. If you need any help regarding enrollment, you can connect with Risa Enterprise on the number provided. And now with this community update, I want to invite our speaker for today, Dr. Mayuri Jain, who is doing excellent work in Bhopal. She's an MDS in OMR, and she's going to share wonderful nuggets with all of us, especially for the beginners, how a beginner probably can start thinking about basal implantology and what are the small tricks which will accelerate the journey, what are the small terminologies which at least if you understand, you will start getting oriented towards basal implantology. Now, those of you who are attending this inner circle session for the first time, you are also invited. I'm sharing the link right now. You are also invited to join our inner circle WhatsApp group. So this WhatsApp group, let me just give you a quick orientation before I hand over to Dr. Mayuri. So basically, just give me a minute. Let me pull out my whiteboard. Yeah. So is my screen visible to all? Just let me know if my screen is visible. So all those who are probably starting their journey in basal implantology, just can you confirm if my screen is visible? Yeah. Okay. Thank you. So for the beginners, you can join the free WhatsApp inner circle group, which the link my team member is sharing, wherein the conversations are not filtered, which means whether you are a beginner, whether you are a mid-level or an advanced user, anyone and everyone can co-interact and provide information to each other. We also have a premium WhatsApp group in which specifically only the selected mentors will be handling your queries for a much more refined conversations. Time to time, there are also special premium WhatsApp inner circle sessions which are restricted to only the premium group members. The last we had was on practice management. Next, for someone who wants to have a more deeper understanding of this science, I suggest you can also consider going through the textbooks. Okay, so we have the surgical and prosthetic textbooks, and we also have the HD video library. So HD video library is basically an entire library of pre-recorded surgeries wherein you will be hearing in real time the thought process which is going through in my mind while doing these surgeries. So that is the HD video library, and we also have some pre-recorded courses in the form of online masterclass. We have a separate online masterclass, especially if anyone is interested only in the zygomatic implants as well. There is a special masterclass, recorded sessions, lectures also on the zygomatic implants. Next, we have some offline events as discussed. the 3-day programs which are happening currently in Mumbai and Coimbatore, and soon Dr. Mayuri will also be sharing details about her program which will be happening in Bhopal. And we have the mentorship programs wherein you can take help of experts while doing the basal implants in your clinic. And we have the 1-day workshops on zygomatic pterygoid implants and the nerve bypass. So that is in short, especially for the beginners, a complete ecosystem wherein you can, kind of start thinking about basal implants in a stepwise approach. Let me also take 2 more minutes, Dr. Mayuri, if you don't mind, and just quickly orient you about the different types of basal implants. So when it comes to the basal implants, these implants are single piece implants, which means in the conventional implants, you have the implant, which is the fixture, and you have the abutment, which means they are in 2 piece. But basal implants by default are single piece implants. Today we will be restricting our conversation to single piece basal implants of R-line series. In the R-line series, implants which are a type of basal implants manufactured in Israel, the designing given by me, you have 2 categories of R-line series implants. The primary category being cementable and the other category being screw retained basal implants. So today, without taking more time from all of you, I've just given a small summary of what is basal implants. They are single piece implants available in cement retained and screw retained options. Right now, we are not discussing the conventional implants which are also available in the R-line series. Today, we request Dr. Mayuri Jain to give us deeper insights into this single piece basal implants from R-line series. With this, I hand over to Dr. Mayuri, and thank you, madam, for joining us and giving your valuable time to this forum. And just you can continue from here, madam. Thank you so much.
Thank you, sir, for providing the opportunity.
Thank you, madam. Thank you. Yeah. Let me just stop my screen share, madam. You can take over. You can share your screen. Yeah.
Hello, everyone. This is Dr. Mayuri Jain Pandey. I am practicing in Bhopal. So today we are going to discuss the power of basal implantology. I'll take some introductory part of the basal implants. So let's start with the basal implantology. Corticobasal implantology is a method or technique using corticobasal implants to establish a bone implant prosthetic system. As we all know that when patient comes to us and there has been all teeth has been extracted, and when there is no functional stimuli present, then alveolus ridge resorption has taken place, which progresses after time. And not only the hard tissue resorption takes place, but also the soft tissue resorption and extraoral resorption also taking place, which worsen with aging. So in some time you will realize we are talking about the future of dentistry, which is a basal implant. Definition of basal implant is it a type of dental implant which is designed to anchor in the basal cortical bone, which is the hard, dense and highly mineralized layer of the jawbone. It is a surgically driven technology, and it is a huge paradigm shift for the thinking of the implantologist. What is the principle of basal implantology? The principle is moreover based on the orthopedic traumatology, We can see in this picture, this is the picture of femur, which is the most load-bearing bone of our body. Orthopedician use bicortical screws to fix the fixture plate. So likewise, we use in the basal implantology, we use bicortical implants and rehabilitate the patient. What is the rationale for using basal implantology? Like we all know, our alveolar bone is made up of two types of bone, the crystal bone, which is the cancellous bone, spongy bone, and the hardest bone is the cortical bone. So our basal implants get engaged in the basal bone, whereas the cortical implants engage in the less dense bone, which is the cancellous bone. Because this is a less cancellous bone, so it is more prone for the infection and resorption. And because basal implants we engage in the rock hard part, cancellous bone, so this is less prone for the resorption. Now we come to the design for the basal implant. In primitive days, we have the left picture showing in the screen. The disc, two type of disc were used to be there in crystal disc and basal disc. Now we have more advanced type of basal implant, which has bicortical screws to engage into the cortical bone. What are the strategic areas for basal implant? For mandible, we have bicortical engagement. In the lingual cortical plate is present, buccal cortical plate is present, and for maxilla, we have a pterygoid region to engage the basal implants, nasopalatine bone, and we also have the maxillary sinus corticals, but these are the weak corticals. And the mid-symphysis region, it is a highly corticalized area, so the basal implants give high strength in this region. What is peri-implant healing? It is like the basal implants are unique, so peri-implant healing is also unique. And being implantologists, we all must know what kind of healing takes place in any kind of implants. There is a multicellular unit present in our bone. When the bone is cut, the first trauma is given to bone, then there is a cone shaped at the cone part of the bone, the osteoclastic activity happens. Whereas in the tail part of the bone, there is osteoblastic activity happen. Haversial canal is present, and during the osteoblastic activity, the new bone formation takes place. So here the sequence of bone remodeling phases during the time of trauma. First, the bone resorption takes place. So osteoclastic activity starts within the 3 days of basal implant placement. This osteoclastic activity, the bone resorption takes place around 4 microns per day. And in reversal system, reversal phase of bone remodeling, the pre-mononuclear cells proliferate, and which leads to the formation of the new osteoblastic cells. Later, the osteoblastic cells, with the help of calcium and phosphorus, mineralizes and form the hard bone at the area of trauma. Now that we come to the types of basal bone, as the sir already told, it is a single basal implants. Sir already told these are the single piece implants. So basal implants we have in these current generation, we have 3 types of basal implants: BCS implants, KOS implants, and micro thread implants. BCS implants, these are the highly polished surface implants, have vertical flutes. Vertical as well as horizontal flutes to engage in the cortical bone. We have KOS implants, which is also known as compressive implants. These implants can be used in the where we can use the conventional implants. These are the abutment part, and the shaft is highly polished, whereas for osseointegration and for D1, D2 type of bone, means where we can use compressive implant, we can use KOS implants. So these are the surface treated implants with calcium phosphorus coating. And BCS implants, for all practical purposes, we can use in all kind of bone, D1 to D4. And micro thread implants are also present, which have narrow shaft, and flutes are also there, narrow flutes, and apical tip is very sharp. These kind of implants, these provide stability, compression, both at the same time. Compression in the compressive crystal bone and the stability at the bicortical bone. So these micro thread implants we can use in the extraction socket, where we can avoid the soft tissue collapse in the socket. And at the same time, micro thread implant can also be used in a pterygoid area where the maxillary bulbous tuberosity is present. So we can take the advantage of the cancellous as well as cortical bone in that area. Now we have R-line implants, which belongs to the impact implants. The difference between the R-line implant and impact implants are, you can see in the picture, R-line implants has more vertical flutes, which engage more, which give more strength bicortically in the bone and highly polished. As compared to the impact implant, we can see the horizontal flutes in the impact implant. So these R-line implants is specially designed by the Rohan Girani sir for the additional advantage in the bone engagement. Now we can talk about the armamentarium used in the basal implants. As you can see in the picture, it is a very less armamentarium as compared to the any conventional implant. We have drills like straight drills, cortical drills, bone expansion screws, ratchet is there, and at the right side we can see the pterygoid tap, which manually scout the pterygoid region. So we can call it a C finder, which is used to scout the pterygoid region manually. First we scout with this C finder, then we drill to find the pterygoid bone. And in the last, we see the driver, implant driver, which is a manual driver. Now we see why basal implant, why we should do basal implant, because first of all it uses basal bone, which is a bicortical bone, which is a strongest part of our jawbone. No need for bone grafting with the basal implant. We can completely avoid the bone grafting because we are engaging our implant into the basal bone, which is a highly mineralized bone. Immediate loading is only possible with the basal implant. We can give processes within 72 hours of the implant placement. High success rate is there. It is a single stage procedure. No chances of peri-implantitis seen. It is cost-effective solution, faster healing and recovery seen in all the cases, and easy patient acceptance is there. What is the difference between conventional implant and basal implant? As I have already discussed, we can give the immediate processes with basal implants in 72 hours, 3 days. It is a totally flapless technique, single hole technique is there. No chances of peri-implantitis with the basal implant, but peri-implantitis is most commonly seen with the conventional implant, because conventional implants are the rough surface implants, whereas basal implants are the highly polished surface implants, so no food lodgement is there, so no chances of peri-implantitis. Obviously, in basal implant, we have to manage the occlusal tables. So more number of implants we have to place in basal implants, 10 to 12 implants in upper jaw and 8 to 10 implants in lower jaw. Screw loosening is the most common with the conventional implants, and we cannot place conventional implant in the resort bridge cases. So it takes the extra effort and time. No way we can give the basal implant treatment because no documentation procedures are needed. Bone retirement we need sufficient, not all of the sufficient bone, we also need the sufficient density to place the conventional implants. But for basal implant, we don't need any density of volume from the bone because primary stability we are having with the help of cortical bone. So no need for the bone development for any kind of bones we can place basal implants. Stability for conventional implants it depends on the bone quality, but the basal implants it is very high stability because osteofixation we are doing with this basal implant. And the treatment time is too much with the conventional implant because it is a two-step procedure. First you have to place the implant and you have to wait for 6 months, and then after 6 months you have to do another surgery and place the prosthesis. But with basal implant it is very short time treatment. You can place the implant and immediately within 72 hours you can get the prosthesis. And because there is a lead time when you are placing the implant and after some time you are getting the prosthesis in conventional implant. So meanwhile you have to get the temporary prosthesis from the patient, but it is extra cost for you as well as for the patient and inconvenience also. But for basal implant, fixed prosthesis and immediate functional loading you can give your patient can issue even after 72 hours. What are the advantages of placing basal implant? First of all, it saves lots of money for you as well as the patient because with basal implant you don't need any sinus surgery, any augmentation surgery, you don't need temporary prosthesis. So around 20 to 30% cost you can save the basal implants. And it also saves the time because you are not doing any surgery and giving prosthesis in 72 hours. It also saves your side time. We are using patient healthy bone, so credibility of success and of this procedure is very high. We are doing immediate functional loading, so this is an additional advantage of basal implant because conventional implant require second and third stage surgery, so duration of time is very long. Patient needs to wait for long on their prosthesis, and after basal implant, patient returns to normal life immediately. And really, there is very less pain as compared to the conventional implant surgery because we are not doing any grafting, any other surgical procedures. So there is very little chances of pain after the implant surgery. Another advantage is the basal implants are very low complication rate because these are highly polished implants. Their design is very good, so there is less chances of food lodgement, and when there is no food lodgement, no bacterial lodgement, there is no infection. So we can avoid the infection and very high success rate. And we don't want any compliance with the treatment. It is very easily manageable. The process is very easily manageable with the basal implants. Another advantage is a simplified and straightforward treatment approach. In cases where two-stage implant has been removed. In day-to-day practice, the number of cases where patient comes to us with the conventional implant because of whatever the reason. So immediately we can remove the conventional implant and immediately replace the basal implant and give the prosthesis in 7 hours. Immediate treatment, even in cases of profound periodontal environment. If patient is having severe periodontitis, we bright the periodontal gums and we can immediately place the implant. No need for periodontal flap surgery, which is actually not a compromised conventional implants in lower jaw because of all the bone is lost. So we have immediately removed all the conventional implant, placed basal implants, and in the last picture we can see 3 months follow-up, which good bone healing we can observe in the last picture. No patient selection is needed, like I've already told. Basal implant is indicated for everyone. We can do any patient with the basal implant. 6 to 6 processes we can give because no enough bone is needed for this. We can start the treatment right when the patient is in your dental chair. If you are extracting the patient teeth, immediately you can say the patient, I can give you immediate teeth after 3 days. We can in this the same socket we can place the implant and I can give you a teeth. And the patient using basal implant technique can fulfill their wish to the patient. They will never have to wear a denture. They will never have to. They will receive the fixed teeth right away. So whenever patient in your chair, you can extract the teeth and immediately place the implant. In many cases I have seen like in जब हम पेशेंट का एक्सट्रैक्शन करते हैं तो पेशेंट एक्सट्रैक्शन करके फिर गायब हो जाते हैं, दे डोंट कम बैक. इन सिमिलर फॉर बेसल इम्प्लांट केसेस हम एक्सट्रैक्शन करेंगे, देन हम बेसल इम्प्लांट प्लेस करेंगे और 3 दिन में रिहैबिलिटेट कर देंगे. तो इन दिस केस यू कैन ग्रेव द पेशेंट, put more implants like conventional. One study has been conducted in Germany in 2019. According to them, conventional implantologists around 30 implants per month place karte hain, whereas basal implantologists 198 implants per month place karte hain approximately, because wo turant extract karke we can place the implant immediately. So regardless what is the bone situation, the treatment is affordable for the patient and they get the teeth, which is the main incentive for the patient. Bending of basal implant. Yes, this is a very unique feature with the basal implant. If we don't get the bone, and like in first picture we can see, I did the canine bypass for this case. I got the bone below the canine region. So I placed the implant in the cortical bone and I bent the implant for my prosthetic ease and for the occlusion. And similarly in the second picture, I did the bicortical engagement, lingual engagement. I bent the implant for my occlusion. So buccal bypass, lingual nerve bypass, we can do with the basal implants. What are the indications for basal implant? Even poor quality of bones, we can do basal implant. In case of failure of 2-stage implant placement, where bone graft sinus lifting procedures are needed, we can do the basal implants. High, thin, knife edge cases, very less buccolingual depth, width, bone height is less, pencil mandible is there. In each and every cases, we can do basal implants. What are the contraindication for basal implant? Likewise, in conventional also, if patient is on high dose of bisphosphonate therapy, we should avoid the basal implant because it provides the osteonecrosis of that jawbone. And patient with facial and trigeminal neuropathies, we should avoid the basal implant. And if patient is having recent history of heart stroke, so we should avoid the basal implant in those cases. Basal implants can only fail if there is lack of sound anatomic knowledge to carry out the successful surgery. It is a very skilled procedure. You need to take the workshops. You need to join the workshops to train yourself, because it is a very skillful surgery. And in some cases, if load distribution and is not proper and you don't know what we are doing, and your uh, treatment planning is not good according, because in basal implant we have to focus on the load distribution on the jaw. If load distribution is proper, you can do anything, and you can avoid the overload osteolysis. Here I'm showing some cases I did with basal implants. Like this case I did around 2 years back. Patient came to me with 3-4 teeth in the mouth in the maxillary region, and the lower ridge is completely edentulous. Patient was not satisfied with her lower denture. She was wearing a removable denture, and she was not satisfied because of slipping or something like that. So I've placed the implant, and I've given the implants to upper arch, and she doesn't wanted to extract the healthy teeth. So we have saved all the healthy teeth. Uh, we have done the root canal treatment, placed pterygoid implants, sinus implants, implants in the sinus region, and I'm getting a very, very satisfactory and good results for this patient. Likewise, this case, we have placed double pterygoid implant, and you can appreciate the uh, loading of the implant in a very good manner. Likewise, in this case, this patient was presented to me with the sinus pneumatization, and many of the dentists has denied them to do this thing, uh, implant, and he just wanted to rehabilitate himself with the implants only. So we did the pterygoid implant, some sinus implant. We rehabilitated the patient. This patient is doing very good. And this was a very good case. We did the conventional implant in lower jaw. And like you can see in upper jaw, there is severe maxillary sinus pneumatization seen. And this patient was not ready for any bone augmentation surgery or sinus lifting procedure. He was afraid of that. So we have suggested him the basal implant, and he was ready for that, and we did it for him, and he's doing really very good. He's very satisfied. So in the conclusion, I have told everything. If you want to save your time,